Every morning, Richard does the same thing. He gets up, makes coffee, and swallows his cholesterol pill right alongside his breakfast. He's done this for 6 years. It's automatic at this point, barely a conscious decision anymore. But here's a question almost nobody ever asks him or themselves. Does it actually matter what time of day you take that pill? Today I'll show you why the answer is yes for some people and no for others, and the one question you should ask your doctor or pharmacist to find out which group you're in. Quick note before we start. This isn't medical advice, just education. Always follow your own doctor's instructions and never change how or when you take a prescribed medication without checking with them first. Now here's why timing matters at all, and why the answer genuinely isn't the same for everyone. Statins are among the most widely prescribed medications in the world, and for good reason. They've been shown repeatedly to lower LDL cholesterol and reduce the risk of heart attack and stroke over the long term. But here's what almost never gets explained clearly at the pharmacy counter. The instructions on the bottle are often generic, take once daily, without any real explanation of why a specific time might matter more for one person's prescription than another's. That gap in explanation is exactly what today's video is meant to close. Your liver isn't producing cholesterol at a constant, steady rate all day long. It actually follows a rhythm tied closely to your sleep-wake cycle, and for most people, that production ramps up overnight while you're sleeping. The enzyme responsible for this, called MNG-CoA reductase, is generally more active during the night than during the day. This is exactly the mechanism that cholesterol-lowering statin medications are designed to target. So in theory, taking your medication at the moment your liver is doing the most cholesterol-producing work should make the drug more effective. Think of it this way. The medication isn't doing much good sitting in your bloodstream during a stretch of the day when your liver's cholesterol factory is running at low capacity anyway. The real value comes from having enough of the drug active in your system during the hours when that factory is running at full speed, which for most people is overnight. That's the entire logic behind why some cholesterol medications are recommended at a specific time, while others aren't affected by timing at all. Here's where it gets more specific and more useful than most people ever hear from a rushed 10-minute appointment. Not all statins behave the same way in your body, and that difference is the whole key to whether timing actually matters for you. Some statins are considered short-acting. This includes simvastatin, lovastatin, and fluvastatin. These medications clear out of your bloodstream fairly quickly, often within just a few hours. Because they don't stick around long, taking a short-acting statin in the morning means its effect has often worn off by the time your liver hits its peak overnight cholesterol production. For these specific medications, evening dosing is generally the more effective choice because it lines the drug's active window up with your liver's most active window. This is actually one of the more well-established pieces of advice in cholesterol management, and it's been reflected in prescribing guidance for years yet in practice. A huge number of patients on these exact medications are still taking them first thing in the morning, simply because that's when they take all their other pills, and nobody specifically flagged that this one is different. Other statins are long-acting. Atorvastatin and rosuvastatin are the two most common examples. These medications stay active in your bloodstream for 20 hours or longer, long enough to cover your liver's overnight cholesterol production, no matter what time of day you take them. If you're on one of these two, the research is pretty clear that time of day makes little meaningful difference to how well the medication works. What matters far more for these particular drugs is simply taking them consistently at roughly the same time every day, rather than which specific hour you choose. This matters practically for a huge number of people, because atorvastatin in particular is one of the most commonly prescribed statins worldwide, if that's what you take. The good news is that you likely don't need to rearrange your routine at all. The timing flexibility built into the medication itself means morning, with your other pills, is perfectly fine as long as it's the same time each day. This is genuinely useful information because it means the honest answer to morning or night depends entirely on which specific medication is in your hand, and that's a detail your prescription bottle usually won't spell out for you in plain language. So here's the first thing worth doing after this video. Look at the actual name of your statin, not just the general category cholesterol medication. And note whether it's one of the short-acting ones, simvastatin, lovastatin, fluvastatin, or one of the long-acting ones, atorvastatin, rosuvastatin, or a few others your doctor can confirm. That one detail tells you whether timing is something worth adjusting or something you can stop worrying about entirely. There's a related detail many people also miss, whether to take your statin with food or on an empty stomach. This varies by specific medication too. Lovastatin, for example, is generally absorbed better when taken with a meal, which actually increases how much of the drug your body takes in. Other statins, like pravastatin, don't have that same food dependency and can be taken with or without a meal without much difference. This is a smaller detail compared to the morning versus evening question, but it's another example of the same underlying theme running through this entire video. Generic advice like take once daily glosses over real differences between individual medications that can meaningfully affect how well they work for you specifically. Now let's talk about 3 common mistakes that come up around cholesterol medication timing, regardless of which type you're taking. The first mistake is inconsistent timing. Taking your medication at 7 a.m. one day, 11 a.m. the next, and sometime after dinner the day after that. For long-acting statins, the exact hour doesn't matter much, but consistency does. Your body absorbs medication more predictably, and you're far less likely to accidentally skip a dose when it's tied to a fixed daily anchor point, like right after brushing your teeth or right before a specific meal. For short-acting statins, inconsistent timing is even more relevant, since drifting in and out of the ideal evening window reduces how well the medication lines up with your liver's overnight activity in the first place. The second mistake involves what you take your medication with. Grapefruit and grapefruit juice are the most well-known example here, and for good reason. Grapefruit contains compounds that interfere with an enzyme your liver uses to break down certain statins, particularly simvastatin, and to a lesser extent, atorvastatin. When that breakdown process is disrupted, the medication can build up to higher than intended levels in your bloodstream, which raises the risk of side effects rather than improving the benefit. This isn't a minor footnote. It's specific enough that many pharmacists flag it directly when they hand you a new prescription. If grapefruit is a regular part of your routine, this is worth asking your doctor or pharmacist about directly, since not every statin carries the same level of risk here. Interestingly, rosuvastatin is generally considered to have little to no interaction with grapefruit. So this is another example of why the specific name of your medication matters far more than the general category cholesterol pill. The third mistake is the quiet one skipping doses here and there without mentioning it to anyone, or stopping the medication altogether because you feel fine and assume it's no longer necessary. Cholesterol medications work cumulatively. Missing one dose doesn't cause a dramatic immediate spike the way missing a blood pressure pill might cause a noticeable symptom. Instead, the effect is gradual, a slow drift back toward higher cholesterol levels over weeks and months, often invisible until a follow-up blood test reveals it. Because there's no immediate warning sign, it's easy to underestimate how much a pattern of missed doses actually matters. and stopping the medication entirely without talking to your doctor first removes any protective effect it was providing. Even if you feel completely fine in the moment, cholesterol control isn't something your body signals to you the way pain or fatigue does. This is worth repeating. Feeling fine is not the same thing as your cholesterol being under control. And the only real way to know is a blood test, not how you feel day to day. There's one more misconception worth clearing up before we wrap up, because it comes up constantly in conversations about statins, muscle soreness. Some people notice muscle aches after starting a statin and assume it must be tied to what time of day they took it, morning versus night. In reality, statin-related muscle discomfort, when it does occur, is generally related to the total dose and how your individual body processes the medication, not the specific clock hour you swallowed the pill. If you're experiencing ongoing muscle pain on a statin, that's absolutely worth reporting to your doctor, but rearranging the time of day on your own, hoping it fixes the soreness. Usually isn't the actual solution. A proper conversation with your doctor about dose, or potentially a different statin entirely, is the right next step. This distinction matters because it's a very common point of confusion. People sometimes switch their own timing, notice no improvement in muscle discomfort, and then quietly stop the medication altogether out of frustration, assuming nothing can be done. That's exactly the wrong conclusion to draw. A persistent side effect deserves a conversation with your doctor about the medication itself, not a self-directed timing experiment that was never going to address the actual cause in the first place. So what should you actually do with all of this? It comes down to one simple action. At your next appointment, or even with a quick call to your pharmacist, ask this exact question. Is my specific statin considered short-acting or long-acting? And does that mean I should be taking it in the morning or at night? That single question takes the general advice you've heard, maybe from a well-meaning friend or a headline somewhere, and turns it into something specific to the exact medication in your hand. It's worth writing this question down before your appointment. Honestly, appointments move quickly, and it's easy to walk out having forgotten the one thing you actually wanted to ask. A written note, even just a line in your phone, ensures this specific question doesn't get lost in the shuffle of a routine checkup covering 5 other things at once. If you're on a short-acting statin and you've been taking it every morning with breakfast out of habit, simply switching that same pill to your evening routine, ideally consistently rather than sporadically, may genuinely improve how effectively it's working for you. And if you're on a long-acting statin, this video might be the thing that finally puts that particular worry to rest. You don't need to obsess over the clock. You just need to keep taking it consistently every single day at whatever time fits your life best. If you watched our earlier video on blood pressure medication timing, this might sound familiar, and that's not a coincidence. A growing number of common medications prescribed to adults over 60 turn out to have a timing component that rarely gets explained clearly, simply because a typical appointment doesn't leave room for it. Cholesterol medications and blood pressure medications are frequently prescribed together, and if you're managing both, it's worth having this exact conversation, short-acting versus long-acting, morning versus evening, for each one individually, rather than assuming they should all be taken the same way simply because they're swallowed at the same moment each day. Let me tell you briefly about a patient I'll call Frank, 66 years old, who'd been taking simvastatin every morning with his coffee for nearly 4 years. Exactly like Richard from the beginning of this video. At a routine follow-up, his LDL cholesterol hadn't improved as much as expected despite good diet and consistent exercise. Rather than immediately increasing his dose, we first looked at timing and switched his simvastatin to an evening dose, taken consistently right before bed instead of at breakfast. At his next lipid panel 3 months later, his numbers had improved meaningfully without any change to his dose, his diet, or his exercise routine. The medication hadn't changed. The timing had. That's the entire point of this video sometimes. The fix isn't a new prescription. It's simply asking the right question about the one you already have. Let's bring it all together. Your liver produces most of its cholesterol overnight, following your natural sleep-wake rhythm. Short-acting statins, simvastatin, lovastatin, fluvastatin, generally work best taken in the evening, so their effect lines up with that overnight production window. Long-acting statins, atorvastatin, rosuvastatin stay active long enough that timing matters far less. And consistency is what actually counts. And regardless of which type you're on, watch out for 3 things: inconsistent timing, grapefruit interactions, and quietly skipping doses without telling your doctor. One last note, particularly if you've also been following our kidney health content on this channel, statins are generally considered safe across most stages of kidney function. But dosing can sometimes need adjustment in more advanced kidney disease, since some statins are cleared from the body partly through the kidneys. If you're managing both cholesterol and kidney health at the same time, that's simply one more reason this exact conversation with your doctor or pharmacist is worth having specifically. Rather than assuming a one-size-fits-all approach applies to your situation. None of this is a reason to make any changes on your own before checking with your doctor or pharmacist first, but it is a reason to ask a more specific, more useful question at your next appointment than most people ever think to ask. Most patients walk in and out of a 5-minute prescription refill without ever hearing the words short-acting or long-acting attached to their own medication, and that single missing detail is exactly what today's video was built to fill in. If this video helped you, consider subscribing to Longevity Insight. We cover topics exactly like this every week, breaking down the small, practical details about common medications that rarely get explained clearly. And I'd genuinely like to know, which statin are you taking, morning or night? Drop it in the comments. I read every single one, and it genuinely helps shape what we cover next. Thank you for watching, and here's to a healthier heart at the right time of day.